menopause, making sure that there's insurance coverage for perimenopause and menopause services. My focus has been in large part on accessibility, affordability, and dignity in healthcare.
So welcome to another episode of the State House Minute. I'm Assemblyman Dave Bailey.
I'm Assemblywoman Heather Simmons.
And Senator John Burzichelli.
Heather, you have really been the force behind healthcare on this team and bringing forward some really tremendous legislation and ideas, especially around women's healthcare. Talk to us a little bit more about what you've been doing.
Thanks, Dave. You know, I was just talking to somebody the other day about how you and I are just finishing up the first half of our first term in the Assembly. You've been focusing a lot on energy and regulatory issues, which really fits into a lot of the committees and the research that you've been doing. And my focus has been in large part on accessibility, affordability, and dignity in healthcare. And one of those areas, as you mentioned, has been in menopause, making sure that there's insurance coverage for perimenopause and menopause services, and also that practicing physicians, as they continue their credits for licensure, have access to perimenopause and menopause topics. But another bill that we're working on, and John now has this bill, I'm proud to say, in the Senate, is the Healthy Hearts Bill. And this one is focused on bringing awareness to and helping teachers and coaches and schools be prepared to address cardiomyopathy.
And you have a real personal experience in this situation as well, so tell us about that.
I do. In fact, one of our interns last semester was my nephew, who I'm proud to say is about to graduate from Temple University as we're taping this next week. And when he was in high school, he collapsed while on a scout trip, and it was a sudden cardiac arrest. And he was without a heartbeat for 11 minutes until he was revived. And as it turns out, he suffers from hypertrophic cardiomyopathy. So building awareness around and quicker response time for cardiomyopathy, which about 1 in 500 young people suffer from, was a big focus of mine coming into the Assembly.
1 out of 500 is a significant number.
Yes.
That's a real number.
And, you know, John, you hear this all too often where a young person on the football field or the baseball field collapses suddenly. And we were lucky that just by coincidence, the person standing next to my nephew when this happened was an emergency room physician who was on his scout trip and was able to identify immediately what was happening. And because of his life being saved, this young man is now an advocate for invisible disabilities like his.
It all comes together, and you know this is an example of the kind of work that this group is doing. I mean, this group of three of us, because we work as a team, 2 houses. Bill's got to move through both houses onto the governor's desk, but we're engaged in a number of issues that aren't partisan issues. And I realize many people out there expect us to be fighting partisan battles. We do that during election season, but when it's not election time, we got to focus on these things that people can agree on and things we can get done that help people like yourself who are watching.
That's a great way to put it, John. So many people call us or stop into the office or see us out and about, and the issues that they talk to us about don't have an R on them. They don't have a D on them. They're about people.
Correct.
That's what we're focused on.
So thank you so much for all your efforts behind that. It is going to make an impact, not only personally the impact it's had, but throughout the state of New Jersey. It's been another State House Minute. I'm Assemblyman Dave Bailey.
I'm Assemblywoman Heather Simmons.
Senator Burzichelli. Till next time.